How does Imatinib treat GIST stomach cancer? Imagine a targeted approach that acts like a precise key fitting into a specific lock. That's how Imatinib works for gastrointestinal stromal tumors, a type of stomach cancer. Most GIST develop because of mutations in genes called KIT or PDGFRA. These mutations cause the proteins they produce to become overactive, sending constant signals that tell the cells to grow and divide uncontrollably. This is what fuels tumor growth in GISTs. Imatinib is a medication that specifically targets these abnormal proteins. It works as a tyrosine kinase inhibitor, meaning it blocks the activity of enzymes called tyrosine kinases that are overactive in GIST cells. It does this by binding to the ATP binding site of the KIT and PDGFRA proteins. This prevents these enzymes from transferring phosphate groups to other proteins, which is a key step in the signaling pathways that promote tumor growth. When these pathways are interrupted, the tumor cells can stop growing, shrink, or stabilize. This medication is used in several ways. It is often prescribed for advanced or metastatic GISTs that cannot be removed surgically. It can also be used before surgery to shrink tumors, making them easier to remove. After surgery, Imatinib may be given as an adjuvant therapy to lower the chance of the cancer coming back. The usual starting dose is 400 milligrams taken orally each day, and patients typically continue treatment until the disease progresses or side effects become too difficult to manage. Most patients respond well to Imatinib, with about 65 to 70% experiencing significant tumor shrinkage. Another 15 to 20% may have their disease stabilize without further growth. Complete disappearance of the tumor is rare but can happen in some cases. The response to treatment can last for more than 2 years in many patients, which is a significant improvement compared to older treatment options. However, resistance can develop over time. This resistance can be primary, meaning the tumor does not respond from the start, or secondary, where the tumor initially shrinks but then begins to grow again. Resistance often occurs because of additional mutations in the KIT or PDGFRA genes that change the structure of the proteins, making Imatinib less effective. When this happens, doctors may switch to other medications like sunitinib or ripretinib, which can target different parts of the signaling pathways. In summary, Imatinib treats GIST stomach cancer by specifically blocking the abnormal proteins that drive tumor growth. It has transformed the outlook for many patients by controlling disease progression and shrinking tumors. Continuous treatment is usually necessary to maintain these benefits, and ongoing research aims to overcome resistance and improve outcomes further. Always remember, each person's situation is unique, so it's essential to work closely with healthcare professionals for personalized care.